going on with Ustream? It's not streaming, is it? Okay, right, guys, we're live. So, David, do you want me to play the video?
Yeah, let's play the video.
Okay.
I was diagnosed with interstitial lung disease, which is stiffening and hardening of the lung, so less oxygen will get inside. I was put onto the transplant list because I was deteriorating. Climbed up a simple set of stairs. It would take me about 15 minutes. So I would climb up about 2 steps, and then I would sit down, take a breather, and then I would start again. After all these years of being sick and being breathless and coughing 24/7, I sat on my bed with my mum, and I just said to my mum, I'm tired now. I just couldn't go on anymore. I was just too tired. And then all of a sudden the phone rang. The call I had was to say that they found a match for me. I was a bit nervous, a bit scared, but I knew I had to have this transplant. I want to be better and be able to do things that I couldn't do before. My health is fantastic. There's no problems, and they are ever so pleased with my progress. I'm doing the British Transplant Games. Last year I did a 1.8-mile walk, which I thought I would never complete, but I did it. I put on my own charity and awareness event last year as well. With the Transplant Games and the charity event, I raised over $4.5 grand. So there's quite a lot of things I've been doing that I couldn't do before. The new law change will enable more organs to be available for people like myself. We would encourage you to think about it and talk amongst your families. People who are waiting on the list, they either will die waiting, or they may get that gift of life. There's nothing you can do with your body once it's gone, so you might as well. One donor can save up to 9 lives, so you'll be helping other people who needs it. I thank every day to the donor family, to my donor, and to God as well. Yeah, I'm just happy.
Okay, ladies and gentlemen, thank you for joining Jamaica Diaspora Health and UK Conversations, Health Legacy. And we're talking today, as you can hear there from the video intro, we're talking today about overcoming health inequality in organ donation and transplantation. And I'm really delighted to say we've got some fantastic guests tonight. If you're watching on Rewind, why didn't you watch in the first place is what I would say. So we've got guests from across the Atlantic. We have Dr. Velma Scantlebury, who's the first Black African-American transplant surgeon joining us tonight. It's fantastic. Then across in the Caribbean, by way of, I think, Photoshop, we've got Michael Willis, and we've also got Michelle Hemmings, who are transplant recipients. And they're going to talk to us a little bit about their journey very shortly. And you would have identified Michelle from the video that just played in the prelude there, I'm sure. And then we have Geraldine-Parker Smith, who is the National BAME Marketing Manager for NHS Blood and Transplant Services. She will be here to obviously tell us about her role as well. Guys, good evening.
Good evening.
Good evening. Great to be here.
Yes.
Yeah.
Wherever you are. Thank you so much for joining us again on a really hot topic here in the UK, particularly. I'd like to first just touch on everybody and just for you to introduce yourselves. So by no order here really, but Dr. Scantlebury, could you just tell us a little bit about yourself, please?
Well, thank you very much for having me on. I am a transplant surgeon. I trained at the University of Pittsburgh in multi-organ kidney transplantation and have been practicing transplantation now for over 30 years. Initially, I started out in liver transplantation and then gradually went on to kidney transplantation. So a lot of that had to do with, one, my desire to focus more on the disparities of healthcare as it relates to end-stage kidney disease and the numbers of patients, especially Black patients who are on the waiting list for organ donation, primarily due to, for us, it's high blood pressure and diabetes, with diabetes being number one, and the vast number of patients on dialysis, and even less on the waiting list, and the increasing predominance of kidney failure. And so dealing with the disparities in healthcare, access to healthcare, and really advocating for patients to be able to get transplants. So, and also working on organ donation, as that's an ongoing issue as far as allowing folks to understand that a lot of the myths and misbeliefs that they hear are not necessarily true, and they need to really think about how organ donation can benefit so many others.
Fantastic. Thank you so much. And you speak about advocates for patients. We've got two patients with us this evening. So Michael, would you tell us a little bit about yourself, please?
Good evening, everyone. Well, first things first, right? My name is Michael Willis. I'm from West Midlands, Birmingham. What's happened to me is such a awesome story, because basically what happened, they gave me 6 months to live. And within that 6 months, my journey started altogether. It was 9 months in total, from start to finish, to having a double lung transplant. Now, when you look at that, it's a fantastic story, but then it's great to be able to tell it to everyone so that they can understand what organ donation is about. You know, myself, again, right, I've had been having galas, right, fundraising to raise funds for research and machinery for the hospitals. You know, it's just something that when I talk about it, it brings tears to my eyes, because I was literally from standing up, normally running around, and being in a wheelchair and oxygen. So if you can imagine a fit, well, young man, right? And then in the next breath, right, I'm on the list waiting to die.
Yeah. And I know that must have been such a strange kind of scenario to sort of digest, and a very real scenario for you there as well, Michael. And Michelle, what's your sort of, tell me about yourself.
Okay,
Hi, Michelle.
Yeah, good evening, everybody. Nice to meet you all. So I had a single lung transplant. There were two elder ladies. They had a heart transplant, and then you had two younger men, and they had double lung transplants. So altogether, there were 5 donors, 5 recipients, and over 40 odd staff who transplanted all of us within 36 hours. And this was 2 years ago. And I was diagnosed with interstitial lung disease and mild hypertension. And I'm here today to tell my story.
Fantastic. Thank you so much.
Thank
And
you.
Geraldine, so as a marketing manager on behalf of the BMA, can you tell us a little bit about yourself and what the role entails as well, please?
Yes, so good evening, everybody. And again, thanks very much for having us on tonight, David. So my role is to engage with the Black and Asian community, to let them know and make the awareness of the need for more people from those communities to become organ donors. And also not just organ donors, again, from the Black community, there's also a need for more people to become blood donors. So that's my role. I do what you call a relationship management piece, where I engage with the Black and Asian community and create campaigns and awareness within those communities to engage with them, to let them know the importance and why we really do need them to consider, especially becoming an organ donor. Because when we look at the registry, there's so many people from the Black and Asian community that are waiting for transplants. But when we look in terms of the database of how many people have signed up to say they're willing to donate their organs, the comparison is just not there. And so my role is mainly to create that awareness, create engagement, create campaigns, create content, so that the people from the Black and Asian community are aware that we really do need them to consider to become an organ donor or a blood donor. And in case of a blood donor, if I could just quickly talk about that, and I know it's not about blood tonight, but it's just that there's a lot of people from the Black community, especially that are suffering from a blood disorder called sickle cell. And in terms of those patients that are suffering from sickle cell, part of their treatment, and to make sure that they have the best treatment, is to receive blood from a Black donor, because from a Black donor, they're more likely to have what we call RO blood. That's a subtype blood group, and it's predominantly found in the Black community. So hence why I do a lot of campaigning and engaging with the Black community, one, to raise the awareness for blood donors, and two, in terms of organ donation, because the best transplant is to come from somebody from your same ethnic background, because then that organ will tend to have a long longevity. So hence why and there's a lot of people from the Black community waiting. So hence my role is to raise the awareness within both of those communities.
Fantastic. Thank you so much for giving us that little background. And that's obviously why we're all here this evening, to sort of discuss the changes that have taken place from a UK point of view, but also to talk about, we've talked about some of the myths that may well be out there, try and break down those barriers, and also just act as a form of education for people. So on the educational front, Dr. Scantlebury, what sort of organs can be transplanted? I think there's a wealth of information that's out there, and some people may feel that some organs are transplantable and some aren't. So what sort of organs are transplantable?
Well, when you think about organ donation, you think about solid organ transplant, which is heart, lungs, liver, kidneys, pancreas, and intestines. In some instances, there are small bowel transplants that can occur, and those are what we call solid organs. In terms of tissue donation, you have corneas, skin, long bone, blood, and different ligaments, even in terms of bone, that can be used for even things such as dental implants or just for jaw reconstruction. So when we think about life-saving organs, we're talking about those that sustain life, such as heart and lung, and liver. Kidneys, patients can survive for some time on dialysis, but ultimately knowing that dialysis is not going to, I should say 50% of people will die on dialysis within 5 years. The gold standard for kidney replacement is going to be kidney transplant, and putting an emphasis on living donation also, because you have so many people competing on the waiting list for organs. If you have your own, find a donor who's going to give you that organ, then you're not competing with the thousands of patients waiting, depending on your blood type. For us, it's about who will survive. And there are many people who will survive with a transplant, but may die waiting on dialysis.
Yeah, and you may well correct me if I'm wrong here, Geraldine, but I think in the UK at least, there are around 6,000 people waiting for an organ transplant, and sort of 3 people unfortunately pass away a day while waiting on the list. So it is crucial that we have this discussion about how we best fill that gap, that void, and open that discussion up. And what sort of things, Geraldine, are we sort of doing in the UK to try and help fill that void, so to speak?
Yes, so we're really trying to make sure that we get the message out there. First of all, to let the community know that the law has changed in around organ donation. That changed back on the 20th of May. And what that change is saying was, what we're saying now is, before we were really encouraging people to register on the organ donation. But what we're saying now is that people have a choice. The choice is you can either sign up and become an organ donor, or you cannot sign up and become an organ donor. But we really want to encourage people to really make sure that they have all the information before they make that decision, whether they will become an organ donor or whether they will not become an organ donor. So as you so rightly said, we don't have enough people on the register from the Black community that are willing to donate their organs. And because of that, so many people are dying because there's not enough organs that for the Black community. So what we're trying to say to what the law is saying to people is, make sure you understand the reason why we need you to become an organ donor. And as we have Michelle and we have Michael here tonight, there are testimonies of people that have received a transplant and their life has been changed or enhanced because they've received that organ transplant. A lot of people, unfortunately, from the Black community, for whatever reason, whether it's because they don't have enough information around it, are not even thinking about signing themselves up and putting themselves on the register. But Michael and Michelle is a testimony here. If they didn't receive that life-changing organ transplantation, they would not be here today. And we want more people to understand the reason why we want them to consider really do and to become an organ donor, because you're literally helping to save, change and improve people's lives. And I would encourage, there's just, as you said, the comparison is, you know, it's very, very low, and we need more people from a Black community to support our own. Let's do it for our own. So many people are dying because there's not enough people on the register, and because of that, lives are being lost. And so I'd encourage people to really consider about becoming an organ donor.
I'd agree there, Geraldine, and thank you very much for sharing that. I mean, in terms of the organ transplant list in the UK, I've read that there's 31% of people who are on the transplant list are from the Black and Asian and minority ethnic communities. And obviously we don't make up 31% of the population overall. So, you know, there's a disproportionate number. And I think, you touched on the testimony of Michael and Michelle, and now's a really good time to talk about their journey in terms of how they came to realization that there was something actually a matter and that something was wrong. So Michelle, what was it, what happened? Can you talk us about the first couple of days, weeks that you realized that something wasn't quite right?
So soon after I had my daughter, about 3 months after I had her, I was having various symptoms. So I was coughing 24/7. Bearing in mind, I was coughing for 22 years. And the day I had my transplant, that's when I stopped coughing. I was feeling breathless. I was being sick 2 or 3 times a day, 2 or 3 times a week. I was going back and forth to my doctors. They'll put it down to probably upper respiratory problem or just a simple cough. And as you know, they'll just give out like simple Lintus or some tablets. Or one doctor even suggested that I should take a trip to the West Indies. I would have gone if they had paid for my plane ticket, but they didn't pay for my ticket.
So we couldn't prescribe for you, is what you're saying.
Pardon?
We couldn't prescribe that for you, is what you were saying.
Yeah, they could have, couldn't they? So this continued for about a year. And then after a year, my mum had enough, just watching me suffering, coughing and being breathless. And she took me straight to A&E. And knowing my mum, she demanded to see a consultant. From then, I was under a consultant. And at first, I thought I had sarcoidosis or lupus, but they diagnosed me with interstitial lung disease and mild hypertension.
Okay. And before I touch on yourself, Michael, I just want to say that today's event is sponsored by Victoria Mutual, Jamaica Moves UK, and obviously we've got sponsorship tonight and representation tonight from Yes I Donate, so the organ donation.
Okay.
Which is fantastic.
That's fantastic news.
Michael, please tell us about your journey and how you came to realize that there was an issue at hand.
Oh, well, first of all, right, it started off with me having a cough and I had this cough for 2 weeks. Then after taking a lot of home remedies and stuff like that, realized that this cough's not going. So what I done, went to the GP, and he turned around and says, oh, I'll give you some antibiotics. He says, this should get rid of it, after a week. After that week, same thing, right? So I went back again. He says, I'll give you some stronger ones, and this should definitely get rid of it. Second week, nothing, same thing. And then he turned around and says, what I need to do is go to the hospital and get an x-ray. Went to the hospital, got an x-ray. And then what was happening? Well, what I had was a shadow over my lungs, right? I had a shadow, and there was 5 little white spots at the bottom. So I'm there going, oh, I wonder if it's cancer. I'm saying to myself, I haven't said anything to anyone, carried on, and still having this cough. And I'm there, but I'm starting to feel tired. And I'm there going, why do I feel tired? Right? Walking up a hill, right? I was sort of like struggling, right? And I thought, well, I'm not working that hard, right? So why should I feel like that? And then because of I'm fit, right? I thought, well, I don't know what's causing it. And one day, this is going on for about a couple of weeks. I was in the bathroom, right? Had a shower, come out, and the next thing, I collapsed. And as I collapsed, right, because I can't breathe, right? So I put my head through the window, trying to get fresh air. My wife, right, says, sit down, and then she called the ambulance, right? When the paramedics came, they says, well, looking at you, right, you look fine, because I was sitting down now. And the next thing they gave me, this nebulizer, right? And straight away, as I had that, all of a sudden, I could breathe. And I was saying to them, can I have some more, right? Because, to not breathe, right, yeah, it's like, how can I describe it? If you hold your nose and just hold it for about 10 seconds, right? That's the way it felt. There's no fresh air, right? And then soon after that, they says, well, I'm going to take you to the hospital. I was reluctant to go at first, right? Went to the hospital, and they just done all these tests, right? For 6 weeks, they couldn't find out what was going on. I was in the hospital. Then I came out, then went back in, and then they turned around and says, I've got sarcoidosis. And I was saying, what's that? And then they described that, the hardening of the lungs, right? And eventually, the whole body can actually shut down. It was very traumatic, right? Not knowing what can be done. Then they turned around after a couple of months and says, well, we're going to put you on the transplant list, right? Went on the transplant list, and then was told you could die waiting, for this transplant. And I'm saying, well, can't I have it now, right? And they says, well, how long is a piece of string? And then I went on the list, and within 67 days, I got the call, and I had to go all the way to Cambridge and have the operation. 12 hours surgery and 7 days in intensive care. Then I woke up, And when I woke up, I was there going, is it done? Is it done? Because before that, I was in a wheelchair, you know, and tell you, God is great.
Michelle, thank you so much, Michael. Michelle, how long were you on the waiting list for yourself, if you don't mind sharing that?
Mine was quite a long one, but a good one. So I was sick for 22 years and I had my transplant 2 years ago. So I was put onto the transplant list 17 years ago, so about 10 years before my transplant. But I wasn't that bad to have the transplant, so I still had an open window. I was still sick. I was sick, but I wasn't sick enough to have the transplant. But 2 years before my transplant, no, about 5 years before my transplant, I was put onto oxygen. So I was carrying a portable oxygen, and I had oxygen in my bedroom as well. And then 2 years before my transplant, I was constantly on my oxygen now. So I was on it 24/7. Like Michael, I was in about 2-3 minutes, then I would get breathless. But because I'm a fighter, I always push myself. So I always push myself to do certain things. So I still got my own business. So I'm a party planner. So about 5 months before I had my transplant, I was still working, but I had the help of my daughter and friends and family.
Fantastic.
So, yeah.
So it sounds like both of you had really good support networks out there, which is obviously crucial in terms of dealing with this sort of scenario that you found yourselves in.
Yeah.
And you know, that drive and desire, you know, if you've got the independence there, Michelle, you commented on,
Definitely.
it does matter, I think, in this regard, and that shows how important that is. Your mom being there for you, Michelle, and your wife, I'm sure, pushing you to the hospital there, Michael, physically, and get you there. Dr. Scantlebury, could you just tell us a little bit about patients in the US and the similar stories, I guess, in regards to the way that they come by your service, but also touch on a little bit, I guess, about the waiting list there as well. Oh, you're muted, I think. Sorry.
Unfortunately, in the United States, we have over 110,000 people on our waiting list. So we have many more people awaiting transplantation. The majority of those patients are in need of kidney transplantation. So I would say about over 90,000 people are awaiting kidney transplants. And the rest are sort of for liver transplant, lung transplant, heart, lungs transplants, pancreas for diabetes, and intestinal transplant for a smaller percentage. And so for us, it's really crucial as the numbers continue to rise that many more patients still, you know, for us, it's about 9 patients die every day waiting for kidney transplant. We still try to advocate for a living donation because while our Surgeon General years ago have had a nidus for hospitals to have at least 75% organ donation for each state to push towards 75% organ donation. For many places, it's still less than 50% of people will agree to organ donation, even though, say, 80% may say they're okay with it, but when it comes down to putting it on the driver's license or agreeing it to do it, then those numbers drop off. And unfortunately, the same thing happens. You need to talk to your family about it because they need to know what your wishes are. And in a few cases, we don't have the opt-out system, but we do have first-person consent. So if it's documented anywhere, then that consent is valid regardless of what the family says. But to some degree, you're not going to debate a family who may, if they're going to push real hard to not have organ donation. So for us, it's really agreeing and getting rid of those myths and misperceptions in terms of people, communities of color who still believe that I need all my organs to get to heaven, and, you know, distrust of the medical community, same basic problems in that, you know, I go to the hospital, you're not going to take care of me if I sign my organ donor card. And we try to stress that, yes, those are things that might, in the past, if you have the Tuskegee experiments and certainly here in America, we have all of these things that have shown that Black people are being used as experiments, and to try to get past that, which is why it's always important to have physicians of color and caregivers, professionals who can really relate to patients and help them get dismiss all of their reluctance to organ donation. But again, even within our system, we have the same thing. About 35% of our waiting lists are African American, but only 12% of the population are African American. So the number one cause being diabetes, and followed by high blood pressure, and those numbers continue to rise as you have obesity and also other diseases such as interstitial nephritis and lupus. Those things continue to add to more and more patients on the waiting list. And the bottom line is that we're all living longer. And so as we live longer, the older we get, the more medical problems we're going to get. So to some degree, even when we focus on living donation, we find that family members cannot be donors because they too have underlying high blood pressure or underlying diabetes. And so that eliminates them as possible donors. But it really is about trying to, for us, even though you're on the list, we still have problems in terms of, we still see late diagnosis, patients who are African American who may not have access to appropriate health care, unlike your system, only get diagnosed in the emergency room. There's no pre-diagnosis in terms of being able to, they can't afford to go to a doctor, so they may not be afford the medications, and so they diagnose late. They're on hemodialysis. They're not getting the correct information about transplant or even living donation. So our goal is to really, our system has changed such that there's a point system. Younger people get younger kidneys in terms of being offered kidneys that are organs that are younger, because they feel like those will be a better benefit than offering a 20-year-old kidney to someone who's 75 years old. Our upper limit for us is for on most patients, most centers, 75 in terms of receiving organ transplantation. And so it's really continued effort to educate our communities. We try to say yes, while we think it's important that people of color give more organs, because yes, it's when you look at immunosuppression and all the drugs, we really want to be able to say you find a kidney, because the longer you're going to wait on dialysis, the more likelihood that you're going to die waiting for those 90,000 people who are out there. And for liver transplantation, which is even less within the communities of color, because then you need to be referred, you need to have financial assistance or the appropriate funds to get those, and even less patients who get lung transplantation who are people of color.
Fantastic. Thank you for sharing the sort of American perspective, which actually touches very well with how we do things in the UK as well. I think health societies aside, the structure of health, the way that the patient is presenting is pretty much the same. The numbers are pretty much the same as well. 80% of people in England support organ donation, but prior to the rule change, only 38% of people opted in. So Geraldine, it sounds like once you've completed your task in the UK, there may well be a role for you across the Atlantic to help facilitate the issues at hand over there. But I wonder whether you, Geraldine, you could just touch on the new law a little bit. I know we touched on it at the start, but if you could explore a little bit more. So this is Max and Kira's law. It received royal assent in March of this year. It's probably gone under the radar a little bit because of the COVID issue. And I wondered if you could just tell us a little bit about it. Before you answer, I'd just like to make certain and clear, we're taking questions on Facebook. So if you want to post those questions as we thrash things through, please post the questions and then we'll put them to our panelists as well. So Geraldine, tell us a bit about the Organ Donation Act and what that means for people.
Yeah, so what it means is what we're saying is come the 20th of May, everybody's automatically on the register. And what we're saying to people, if you don't want to be on the register, you still have the choice to take yourself off the register. But what we're asking you to do is that you record that choice on our donor database. So you, if you want to become an organ donor, then we're asking you just to record that on our donor database. The reason being is the reason why they went over to the change of law, we think that more people will become organ donors once they're on that register. And if they don't want to be on the register, then they have to take themselves off the register. In terms of going back to what the doctor was saying about the misconceptions that are out there, and again, we have the similar things here in the UK about the mistrust with the NHS, and about, again, when you're in the hospital and your loved one has passed, the SNOD will then come and approach the family. And if you haven't recorded your decision on the register, then the SNOD, which is a specialist nurse, will ask the family when it's a very crucial time, you know, your loved one has just passed, and they're asking the question, would you like to donate your loved one's organs? So that's why we're trying to encourage everyone that if you do want to become an organ donor, please do make sure that you contact our organ donor transplant register, and that you register your decision on our database, because it then becomes more easier when that time does happen, that we've got your recorded decision there. And also, again, I think the doctor touched, you have that decision. So you've made your decision, you've registered, and you've put yourself on the organ donor register. Brilliant. But at the same time, when it comes to that crucial time and the specialist nurse speaks to the family, your family can still override that decision. So it's really vital that you have that discussion, not just record and put your decision on the organ donor base, but you also have that discussion with your family and let them know what your choice is. So when it comes to it, as well as it being registered, you've already had that discussion with your family. So your family are able to say, yes, I did have that discussion with my son, with my loved one, and I do know their choice, and their choice was to donate their organs. So yes, please go ahead. So what the campaign is trying to encourage people to say, yes, you have a choice whether you want to become an organ donor or not. We're automatically saying everybody's on the register, but until you registered that decision on our donor base, that's what we're trying to encourage people to do, and also to let them know that you still have a choice, and also to let them know, have those conversations with your family, because it's very, very vital that your family is aware of what your choice was. Even though you may have registered and put on the donor base, but didn't have that discussion with your family. And when it comes to that crucial time, when we go to the family, if you didn't have that conversation, family could override that decision of your choice.
Thank you very much for making that painfully clear, that the two issues at hand from what you were saying there is that you need to record the decision on NHS on the organ donor register. So you have to register that to yourself. Because the assumption here is that you are opting in and that you have to opt out. Yeah. And the second thing is that you need to have that conversation. You need to have that conversation with your friends and family. We're having that conversation today, obviously. And I know that I before all of this, I hadn't really thought about it to the extent that I have in the past few weeks as things have ruminated in my mind. And Michael and Michelle, I don't know whether you'd like to share your personal thoughts on this. And please feel free not to, if you don't want to. But what were your thoughts about transplantation before all of this? I know it's easy to say now, but what were your thoughts before all of this?
Should I go first?
Yeah, go ahead.
I didn't know much about it. I didn't know much about it, but since becoming a recipient, I know there's a great need for it now, because if I hadn't had my transplant, I was told that I would have had probably about a year to live. So I know there's other people who are waiting for that special gift of life, just like myself and Michael. But I'm just trying to raise awareness to everyone, especially in the BME sector, that we need yourselves to think about it and talk amongst yourselves, your families, and make that important decision, because you will be saving quite a few lives. Because as you know, one donor can save up to 9 lives. So yeah.
Could I just jump in there really quickly before Michael goes? And just want to say, Michelle campaigns tremendously. She works very closely with my team, with myself, and she does a lot of work going out in the community and campaigning and raising awareness, and she's fantastic. And it's exactly the same for Michael. Again, works very closely and goes out and does a lot of that campaigning to raise the awareness within the Black community. And you know, people like Michelle, and hearing her story, I really hope that people really will consider and think about organ donation and really realize how important it is and how it literally is helping to save and improve lives. And they're fantastic because they've received, they now want to be able to give back and encourage so that they can help others. So it's fantastic. Sorry, Michael.
Thank you.
And Michael, had you any thoughts about transplantation beforehand?
Well, yeah, because what used to happen, I used to see, you know, these donor cards in the surgery and at the hospital. And I remember I used to pick them up and look at it and go, who would want to be a donor, and just throw it to one side. And then as time goes on, you know, like they always say, until you're in that position, you realize how valuable, you know, that card was, you know, because like when I had mine, you know, what I'm saying is within 9 months of going to work, being fit, you know, to actually be in a wheelchair, oxygen, right? Can't go up the stairs, you know, literally just waiting to die. That's what it was, you know, with me, you know. And I thought, well, you know, because at one stage I thought, well, I can't live like this, might as well give up, you know. But then my wife was behind me and going, you know, you got to keep fighting, you got to keep fighting, come through the other side. And everyone looks at me. Some people now, this is only 3 years, they're saying, did you really have that operation? You know, because they can't believe, you know, a major operation like that. And there's hardly any scars. Right? I got like 2 inches on either side. That's all. You know, and you know, everyone's just sort of like, wow, you know, just keep it up.
Fantastic. And so from that, from both of you, you know, experience, the unfortunate experience has taught a great deal of wisdom from both of you. And it's been fantastic hearing your stories thus far. And I'm really eager to explore them even further. But I'm also acutely aware that there are questions that are coming in both on Facebook and on YouTube. And so one of those questions was really related to organ transplantation. Who can donate? So I think I'd find that question either Dr. Scantlebury or Geraldine, really. Who can donate?
I think for us, anyone can donate as long as they can sign their own consent. So they have to be over 18. As far as living donation, as far as deceased donation, then anyone can donate. We have done kidneys and organs from 6-month-old, 1-year-old, and put them into young people. And so as long as the organs can find a suitable size match in terms of, especially for livers and heart and lung, it's more related to size. And as far as the upper age, it all depends on which organs are transplanted. We have people in their 80s who are still organ donors for liver transplantation. For heart transplantation, it may be a little bit less, maybe in the 60s, but generally, and kidneys up to about in their 70s. So we tell our citizens and our residents, don't rule yourself out as a donor. There may be something somebody may benefit from. So don't say I have this or this, because we use organs from people who have high blood pressure and diabetes. We may biopsy them to make sure they're okay. We use livers from some patients who may be alcoholic in the past, but then if the livers are not too bad, we can still help, somebody else can still survive on that. So don't rule yourself out. Leave the option open for whatever is possible to donate.
And Geraldine, any comments from the UK perspective in terms of who can?
It's similar to what the doctor just said. It is similar to that. Yeah.
And I think that the flip question therefore is, who can't donate? What kind of patients are we thinking about there, Dr. Scantlebury?
Well, one of the things we look in terms of, you don't want to transmit things to the recipient, the person receiving. So it becomes very important to make sure that any potential donor is screened thoroughly for any diseases or cancers or what may inherently become a problem in the person receiving. So obviously the information for deceased donors is only as good as the person telling the story. So you want to really have reliable family members who really know what's going on. If there's any history of cancer, then most people will back away unless it's something that's probably not going to be transmittable. There are some brain cancers that you can still use the organs without worrying about transmission. If it's more than 10, 20, 30 years ago, there's some people who will still be willing to use those. So that becomes important. And so also in terms of, you want to make sure in this country, if you're HIV positive, you can donate to HIV positive, to recipients who are HIV positive. Hepatitis C, also the same thing. We have now used hepatitis C to non-hepatitis C patients. And this, hepatitis B, those are things, if you're actively infected, certainly no one is going to use organs in anyone who has an ongoing active infection, because those things can become pretty dangerous and overwhelming for the recipient. So you want to, if you're taking the lungs and you bronch that lungs and you find that there's lots of bacteria and the infection in the lungs, and you're not going to use those because you're going to carry that stuff over to the recipient, who can potentially become devastatingly ill and septic from the organisms from the recipient, from the donor, especially since you're going to put them on anti-rejection medicine, which is going to wipe out their immune system.
Right, fantastic. Before I touch on the next question, I must say I've not introduced Dr. Scantlebury fully, and she didn't mention this, but she is also an author. And so she has a book in production. And one of my thought processes here was to give away a copy of the book, maybe signed if we're lucky enough, for the best question that comes out in this afternoon's or this evening's webcast. So keep the questions coming. And the next question I think is related again to Dr. Scantlebury. It's quite a specific question, and I don't know if we'll be able to answer this, but there's a question about the success rate of single and double lung transplant. And maybe Michael and Michelle may be able to touch on this as well, because it may well have been a discussion with you at the time of having your transplants. But it's quite a specific question, and I guess it would relate to the patient as well. But I don't know if you can give any insight into that in terms of the success rate.
As with any organs, it all depends on how well your body tolerates that organ. And for anyone receiving the transplant, it's all about continuous surveillance and biopsies to make sure that there's not we look for what's called acute rejection, to make sure your body isn't acutely trying to get rid of the organ, and also for chronic rejection over time. And so whether it's lungs or kidneys, that tend to be a lot more similar, you require daily medications. And so those medications alter your immune system and protect that kidney or that lung, allow it to be not recognized and destroyed. So basically, if you are in sync and your immune system do well with that organ, whether it be, let's say for lungs, for instance, you can go 10, 15 years with a lung transplant. I've seen people who are 20 years out from their lung transplant. But it's all about monitoring and watching for development of scar tissue, which appears as you develop ongoing rejection. And also in terms of some medications are better or not so good for the lungs. And so over time, you may find you may switch over some medication to benefit from less scarring. They may add prednisone to decrease the amount of scarring and increase longevity of the organ. So it's really an ongoing monitoring. It's just not getting the organ and saying adios. You have to constantly make sure your drug levels are appropriate, not too high, not too low, so that you continue for long-term outcomes and long-term survival of that organ, and keep your body from destroying it over time. But like anything, organs are like cars. If you take care of them, they'll last a long time. And they can keep a car for 5 years. You can buy a new car and still get 15, 20 years out of it. So same thing with organ transplants. If you maintain good condition and less problems, it it's not going to last forever unless you have an identical twin that's your same genetic makeup, and therefore your body will see it as the same. But the goal is to at least do preventative surveillance and treat accordingly so you can get as many years as possible.
That's a fantastic point, Dr. Scantlebury. I mean, it's not a silver bullet, but at the same time, protecting and taking care of your organ is crucial to moving forward. And in that breath, I think Michelle and Michael, I wondered if you comment on life after having a transplantation. If you could, that would be fantastic, I think.
Okay, should I go first, or do you want to go first, Michael?
Go on, you.
Ladies first.
So before my transplant, well, I'm still a party organizer, so I was still doing my jobs out there. I was fine for about 15 years, but then eventually I was slowly deteriorating, so I was getting more breathless now. I was on a lot of drugs and my inhalers. So about 5 years before my transplant, as I said, I was on oxygen and I was in a wheelchair as well. 2 years before, I was constantly on my oxygen 24/7. And for me to walk up a flight of stairs would take me about 10 to 15 minutes. So this will go on for 2 years every night until I had my transplant. So if you can imagine, you got your oxygen on, you're breathless, and you're having to walk up that flight of stairs. A lot of people take it for granted, just walk up and down the stairs. But for me, it was a case of standing by the stairs and thinking, can I make up the stairs tonight? Because there's no way I was going to have a bed downstairs. I wasn't going to give up yet. So every night I would fight to walk up them flight of stairs. Even though it would take me about 15 minutes, I still went up them stairs. Back in 2017, I was called once for a possible organ. The ambulance came and picked me up and drove me all the way to Papua. I was there for about, I think about 7 or 8 hours. I got myself cleansed down, dressed in a gown, and I had to wait around. The doctors came back once or twice to say that the donor was still with us, but we're still waiting. So while I'm there, the person is there as well. So after about 6 hours, 7 hours, the doctor would come back and say that the organ was a match, but it wasn't successful to go inside of me. So before they put the organ inside of you, they do all the checks. So probably a couple of the checks wasn't successful to go inside of me. But anyway, a year before my transplant, I had another call. They came and picked me up again, drove me all the way to Cambridge. And that's when it all happened. So I had my transplant. And since then, my life has just turned around. I'm able to walk up and down the stairs now. I did a 1.8 mile walk at the British Transplant Games. I was due to, thank you, I was due to do one this year, but due to COVID, it's been postponed to next year. So instead, I have set up a GoFundMe page to help give a newly transplanted patient a gift bag. So all those transplant patients at Papua Hospital will receive a gift bag. So for yourself to sponsor a patient will cost you £10. So that's what I'm doing at the moment. I put on my own charity and awareness event last year. And overall, with the Transplant Games and the event, I raised over £4,500. Thank you. Thanks. I donated half of that funds to Papua Hospital and the other half to Sandwell, West Midlands, Birmingham Hospital here, better known as City Hospital. I've got so many things coming up. If I just touch on a few, I'm organising a bike and a walk to raise awareness for Organ Donation Week, which is the 7th to the 13th of September. I'm also organising a Zoom concert via Zoom. So I'm going to have a lot of actors, singers, spoken words. If anybody would like to support myself for the Zoom concert, just contact myself or contact Dr. Burton. It'd be most appreciated. I'm doing so many things, and I want to do my book as well. So I've started. So I'm hoping that could be published by the end of this year or the beginning of next year. But yeah, I'm doing so many wonderful things, and I'm so grateful to my donor.
Thank you, Michelle. And Michael, could you just comment on again, sort of your path after having had the transplant itself, and yeah, so let us know what have you faced, and what things have come up in your life.
Well, first thing, one of the things I'm trying to find out is, you know, another person, Afro-Caribbean, who's had a double lung transplant. You know, I've been searching and searching, can't find, you know, I've been told I'm the first one to have it done in Papworth, you know, hospital. But then, you know, I'm not sure exactly, you know, how true that is. But I'll just have to persevere and just, you know, keep fighting and trying to find out, you know, if that's really true. Also, again, you know, like what Michelle says, right? I've done events for the past 2 years, right? And well, we have raised like 12,000, right? And every penny has gone to the hospitals. You know, it's just fundraising, right? Because I'm really interested to find out exactly, you know, how we can spread this organ donation to the BAME, you know, because there's a lot out there, right, to be done, but it's going to take a long time. And like what I said at my last event, one thing I'm glad is that people have to opt out. Then I ain't got to campaign that hard. You know, it makes it a lot easier. But then even though I say that, right, I'm still there pushing on, you know, all the time.
I think it's fantastic that you are both championing at the bit to campaign, to fundraise, to get people inclusive in this discussion and this matter. And I think you're a credit to patients that are out there in terms of being advocates. And
breaking up.
Oh, am I breaking up? Can you hear me?
Oh, it's breaking up.
Yeah, I was saying that you're both a credit to patients out there, and I think it's a fantastic effort.
Freezing.
Thank you. And this might sound like a really strange segue, but you know, we've talked about organ transplantation, how it affects obviously the BME community. But let's look at the flip side here and try to pick apart how it is that Dr. Scantlebury decided to come into medicine, but also what drew her into the speciality of organ transplantation. If you could tell us a little bit about those two things, what drew you into medicine first of all, and then organ transplantation, being the first female African-American organ transplant surgeon?
Well, thank you. I knew I wanted to be a doctor growing up in Barbados. I sort of saw my sister die and wanted my ability to help others. And so I came to, my parents brought us to this country as a teenager. And when I attended medical school, I sort of fell in love with gross anatomy and the whole idea of dissecting the body and what parts, what goes where and what does what. And I knew from that first class in medical school that I wanted to be a surgeon. However, most of my, or I should say my preceptor, didn't really see me as having the ability to be a surgeon. And he pretty much refused to write a letter of recommendation for me to go on to a residency in surgery. And he told me rather, I could be something else. I could be a dermatologist or even a pediatrician, but I didn't have what it took to be a surgeon. And I sort of got my determination from my mother. And so I was going to try anyway. And knowing that without that letter, I was sort of naive to think that I would still get into a residency program. And I didn't match, but I did rotate as a medical student at Harlem Hospital in Brooklyn, in New York City. And during my rotation there as a third-year medical student, I met the very first female surgeon who was dynamic, and her name was Dr. Barbara Barlow, and she was a pediatric surgeon, and I wanted to be just like her. And I think because of her, she advocated for me to get my internship at Harlem Hospital. I ended up staying on there for my residency. And she took me under her wings. And in my quest to be a pediatric surgeon, I had to do research. And my research ended up back at Columbia University in transplantation, and that she made possible for about 6 months during my training. And so I did kidney transplants in animals, looking at the effects of drugs. And that was going to be my segue into finding a pediatric surgery fellowship. As I went to interview for pediatric surgery in Pittsburgh at the time, I was told that I wasn't competitive enough, but I needed about 2 years and 2 years more of research in order to be considered as a highly competitive candidate. But since I was interested in transplant, I should come back to University of Pittsburgh. He'll talk to Dr. Starzo. And that's how I ended up coming back to University of Pittsburgh to do transplantation research to become a better qualified pediatric surgeon, but ended up doing, falling in love with transplant and seeing that you didn't have to be a pediatric surgeon to do pediatric transplantation, and stayed on with my focus initially in pediatric transplantation, both liver and kidney. So that's how I got started. But I have to say that there were so many obstacles for me, and that's why the title of my book is Beyond Every Wall, because whether it was, from dealing with the colorism in Barbados, the whole idea in the Caribbean, if you're darker than a paper bag, then you're sort of, you're one step down than those who are lighter than a paper bag. And then coming to Brooklyn and having to deal with issues in schools as a Caribbean a person and as a Black person, my school counselor really didn't see me as having potential to go any place. And she also told me I should get a job and go to night school. And my parents said, absolutely not. And so my quest was always trying to be someone that I wanted to be, despite the negativity that I encountered along the way. And even in terms of being the first Black female surgeon in transplantation, having to deal with patients who, Pittsburgh was a whole different from being in New York, where you have a diaspora of all kinds of people. And now I'm in the quote Midwest, even though it doesn't sound like it's just far from the East, but it seemed like it was in the middle of the country. And you have patients who go, well, you can't, you're not going to touch me. Where is a real doctor going to come see me? That sort of thing. And so the rejection that I faced and all the hurdles I had to go through was quite challenging, because surgery was and probably still is a man's world. And I see the residents now having to deal with the same implicit bias and racism that I dealt with 30 years ago. Things have changed a tad, but we still have to deal with a lot with it in terms of being seen less competent. But I sort of learned after going through a period of really poor self-esteem, not seeing myself as being capable. And, these days they call it the imposter syndrome, where you feel like you're not real. Well, it's not that you feel you're not real, it's other people make you feel you're not real, or that you're not competent. And it's really about trying to overcome that and really lift myself up to see that, yes, all things are possible through Christ. He's the one who gave me this ability. He's the one who helped me get to where I am. And he's the one who gave me the gifts that I have to be able to help others. And so I am in a place where I like to mentor. I like to allow students to see that, yes, you can be a surgeon. You can be president of this country, and don't let anyone deny you those abilities just because of your skin color. We're dealing with those issues now currently as far as the injustices of this country, as far as people of color. And so the big thing is, don't judge me by the color of my skin. I still have patients who go, well, that's the issue. And so you really want the backing of your team to say, these are, yes, she will take care of you, as opposed to, we'll find you another doctor. 20 years ago, we'll get somebody else to do your operation. These days, you don't do that anymore. So we're beginning to see some progress, but it's been a challenge.
It's been a challenge. And so, for all the panelists here, we've all had those challenges, and you can now go beyond the wall, as Dr. Scantlebury's book is entitled. You already have gone beyond the wall, Michael and Michelle, in regards to how you've coped and gone through the passage in regards to your transplantation. I think, you know, you all had inspiring stories here to share with us this evening. And I'd just like to thank you again. Dr. Scantlebury touched on imposter syndrome, and there's a question which kind of relates to that in some parts. There's a question from Michelle and for Michael. Do they feel any part of their personality has changed after having an organ transplantation? It's one of those questions or myths that are out there, but I wonder whether you could touch on that at all.
Yeah, for myself, before I was quietly spoken, but now I feel more confident in certain situations. So I tend to speak out now. I've been invited to a lot of events, so I'm a guest speaker, so I'm able to talk. So I feel like I'm nervous, but a lot of people say, no, you wasn't nervous, you were fine. And the first time I did a talk was at Ely Cathedral in Cambridge. And I thought there was about 500 people there, so I was fine with that. But when I stood at the front and then somebody told me that there was over 1,500 people in the church, I thought, keep calm, keep calm. But luckily I had a doctor next to me and she gave me some tips of, you know, to breathe in and out and just look straight forward. So I was fine. So I'm okay going out and doing events. So I'm a bit confident, more confident, and yeah, a bit stronger as well.
And Michael?
Yeah, more or less the same, but because I'm always in the background being quiet, but then since the operation, right, I'm able to go out and speak more fluently, you know, to everyone, and, you know, just make them know that, you know, life is sweet on this side, you know. So basically what you have to do is just spread the word, you know. It's just fantastic, you know. And then whatever I do, I just say, well, I'm living proof. And then once I say that now, right, everyone sort of, you know, sit back and look and go, yeah, that's true. They go, look at him, you know, looking at him, it doesn't look like he's at an operation. It doesn't look his age, you know. I've got everything good going for me.
I must say, Michael, you look very youthful with the palm tree in the background and the blue skies there.
Yeah.
Well, this is it, yeah.
I know sometimes some patients say that they taste changes. Like now they hated peanut butter before, but now all of a sudden after transplant, they find that they have a desire to eat something that they didn't like before. Have you found any changes in your appetite or things that you felt was kind of strange that you now gravitate towards?
No, I'm still loving my food, but I still have to be careful because I'm steroid induced, as you may know, doctor. So I'm taking insulin every morning now, but I'm trying my best to calm my feet. But I'm just being very careful in what I eat and what my diet is as well. And
another question that I personally have for you is in relation to COVID-19 and how that's really changed things for you in your lives in the short term and possibly in the long term. But in the short term, what sort of effect has it had on you? And Geraldine, I'll ask you a question here as well. What sort of support services are out there for people who are going through difficulties during this period with COVID-19? Is there any particular advice that one could get from the NHS and such? So Michelle and Michael, first part, if you could touch on your experiences through quarantine and obviously as we open up from the lockdown.
Okay, I've been shielding just like Michael since March. I haven't been anywhere apart from my house to my garden. I have been to my GPs and to the hospital for appointments. I've been doing like exercising in my gardens. I've been doing like 3,000 to 4,000 steps a day when it's a good weather. I've been doing mini workouts, and I've been kept busy working alongside organ donation and Geraldine-Parker. So yeah, in the beginning, I was a bit scared and a bit worried, but I would say probably in April, I was starting to get used to being shielded. I just kept myself busy. So there's certain tasks that I was doing, i.e. doing a bit of housework, a bit of cooking, exercising, doing tasks for organ donation, doing videos for NHS organ donation. So my motto is keep on being busy. So I've been busy since I was sick. So I'm kind of used to keeping myself busy. Even if it's a big thing or a little thing, I always keep myself busy. But yeah, everything seems to be going on along fine now.
Fantastic. So keep calm, be busy. I like that. That's a nice.
Yes.
Take that away from today. And Michael, yourself, how has quarantine or self isolation been for you, and so on and so forth?
Well, it's been okay, because one of the things is, you know, because of like the transplant, and you know, you got to be careful. Anyone got a cold or anything like that, right? You have to isolate yourself away from them. So this is not really foreign country to me, right? You know, because I always used to stop in anyway, you know. So I mean, I haven't been anywhere since the 19th of March. You know, I've stopped in, right? Just keep myself occupied, you know, on the computer, you know, doing all sorts, right? And you know, just carry on, you know, even if it continues till September, I'll be okay. You know, right? I'm just on the ball, because you know, you just got one chance, right? And this is it. You know, I'm not sure, right, if they'll have a second chance, you know, of life. So you have to just enjoy it while you can.
Enjoy while you can. I get that. So Geraldine, support services?
Yeah, so what I can say in terms of NHSBT, what we try to encourage people, so whether you're waiting for an organ transplant, or whether you've received an organ transplant, or even if you're one of those people that are vulnerable, if you're a diabetic or you have any of those underlying health conditions, I would say follow the guidelines that the government put out there and keep yourself shielded. Stay in, stay safe, especially from the Black and Asian community, because a lot of us do suffer from a lot of these illnesses, either waiting for transplant or received, or have any other underlying health issues. We've got to follow those guidelines and stay in and keep ourselves safe. And that would be, that would be my words of wisdom and advice to our Black community.
Fantastic, thank you. And Dr. Scantlebury, I'm cognizant of time here, so we're wrapping down. So I've got a couple more questions that are coming in. With so many transplants put on hold because of COVID-19, there's a question regarding organs and how long they could be stored for even. I know in the UK here, we've obviously had a problem in regards to the number of transplantations that we could do safely and actively. The transplant numbers are down. If you correct me if I'm wrong there, Geraldine, in terms of numbers that have to date. But yeah, the question is really related to what can be done, or can they be stored? How long can they be stored for? I think it's quite a general question again.
Yeah, really. As far as organs that they really can't be stored. So even what we do is, if you can't use them, then you just don't remove them. From that standpoint, the biggest challenge in terms of COVID is really keeping patients out of the hospital. Only those things that are emergencies, such as heart transplant. Keeping the team safe is an issue in terms of even from the operating room. What we've been doing is having to be a little bit more selective in picking those recipients and using those organs that are going to more likely work immediately, so we can get the patients out of the hospital and not have them have to stick around for potential complications. So we stayed away from doing elderly patients or patients who have a lot of disease processes that may complicate the course, and just have really just used the younger patients. A lot of patients are still reluctant coming into the hospital to get transplanted because they're still afraid of getting COVID. So a lot of organs are being turned down because of the problems. You can't really store them. So if patients aren't going to agree to come in and you don't have a recipient who you feel will do well, generally most people end up passing. But we're pretty much getting back to speed right now. But Hearts have to be in 4 hours. Livers are pretty much, can go about 12 hours, but most people, the sooner you take them out, the sooner you get them in, the better they work. So you really don't want them to sit around too long. But you can transport kidneys and they can go last outside on a pump or on ice, not frozen, but on 4 degrees for about 48 hours. But again, you don't want to push them. And then usually it's just for transport from one place to another.
Okay, and then one final question for Dr. Scantlebury again is, which organs can be donated by a living donor?
Living donor, you can give one of your lungs because you have 2. You can't give your heart because you need your heart. You can give part of your liver as a living donor. You can give one of your kidneys. They've given up on using pancreas, part of pancreas as a living donor because the donors have become diabetic down the line from not enough pancreas left or not enough insulin being produced. And so far we haven't really used living donor intestinal transplants. There's some 1 or 2 here, but generally it's lung, liver, and kidneys as far as living donation.
Thank you so much. So we're fast approaching, and we've been talking for more than an hour and 20 minutes about this, and I could keep on talking all this evening, but we have to wrap it up, unfortunately. So we're on to the final thought section. And before we go on to the final thought section, I just wanted to say that this event today is sponsored by Victoria Mutual, also supported by Jamaica Moves UK, and also brought to you by the NHS Transplant team as well. So thank you very much for supporting this evening. And so final thoughts, guys. It's been a really great discussion. First of all, I'm going to probably touch on Michelle here to just tell us a bit more about the GoFundMe page and the sponsor gift bag, to enlighten us again about that again. But what are your final thoughts? If you could just collect your thoughts for me on today's discussion and any tidbits you would like people to go away with.
Okay, so I have 1 single lung at the moment, so I'm looking after my single lung the best I can. So it's like gold to me. If you can imagine, there's people out there who's waiting for a transplant, well, an organ, and it'd be a better match if it's from the same ethnic community, so Black and Black, Asian. So I'm just asking you all to think about it and talk amongst yourselves, talk amongst your families, and sign up onto the organ register list. You'll be helping a great deal of people. And look at me, I'm here to talk about my story and my gift of life. You'll be making hundreds of other people happy and grateful for your services. So yeah, and also my GoFundMe page. My GoFundMe page is to go oh gosh, I'm getting lost now. To sponsor a gift to a newly transplanted patient. So all those patients who have a transplant, they will get a gift bag, and that gift bag will cost £10. So if you go on to RPH, Royal Papworth Hospital, sponsor a gift bag, it only costs £10. But if you want to sponsor more patients, then you can sponsor up to 2-3 people. So if I say that again, it's RPH, sponsor a gift bag, and it only costs £10 to sponsor a newly transplanted patient. And thank you everybody for listening and just supporting us all. Thank you to everybody and to the guest speakers as well.
Let's take it. And Michael, any final thoughts from today?
Well, just to enhance what Michelle was saying, basically, people should, well, she said sign on, right? But they're already there. I'm saying don't sign out,
Yes.
Don't opt out, right? Because every organ is like gold dust, so we just have to just keep it real, for what it is, and just carry on. Also, I'm launching a website which should be soon, and it's Michael Willis Foundation at bt.com. All right, and also a black tie event, but when we actually get it running, right, we'll be able to highlight what is going on. You know, but, it's just awesome to be alive. You know,
I can see that in your eyes, Michael. It's beautiful.
Yeah.
And so just keep us abreast of that, and we can obviously share those details later on through the Jamaica Diaspora UK. Geraldine, any final thoughts?
Yeah, so just to kind of give a little bit more sort of figures, so 30% of those waiting for an organ transplant are from the Black and Asian community, whilst only 8% of those are registered on the organ donor register. So, and again, as we, you know, Michelle's touched upon it, and I think I've mentioned it earlier, there's a high level of success when both organ donor and transplant recipients share the same ethnicity. Yeah. So I really would like to just encourage people to really consider, so we've already said, yes, you're on the register, but we really, really want you to consider and make sure that you register your decision on the organ donor register to say that you're happy to become an organ donor. And then once you've considered, and you know, you have that choice, you're gonna then record your decision on the organ register, and them asking you then to share that decision with your loved ones, with your family, with your friends, so that they are aware. And again, I would also ask you to encourage, spread the word amongst the community, let them know the importance of why we need more people from the Black and Asian community to really, really consider becoming an organ donor, because there are so many people, as I said, so many patients waiting for a transplant, and we can make the difference for our community. So let's do it. I'm passionate about my job because I'm looking to make a difference in my community, and that's why I get up and go to work every day to encourage people to become either a blood donor or an organ donor. Why? Because it's for my community. The more people that register, the more lives we're helping to save and improve. So I'm just asking people to really consider that.
Geraldine, thank you so much for sharing your passion on that endeavor, and again enlightening us as to how important it is to communicate those decisions to our relatives, to our friends, to our family, and have those discussions. Dr. Scantlebury, final thoughts?
We have a bumper sticker here that says, "Don't take your organs to heaven. Heaven knows they need them here on earth." But now you can't assume that everybody's going to go into heaven. So I would change that to say, "Don't take your organs into the ground. Leave them above the ground so others can be helped."
Mm-hmm.
Because what are you going to do? From dust we came, and to dust we will return. So why not pass on your own legacy and your own, you know, be able to help others through your death, in terms of being able to say you can live on through someone else. So that's something that your family would always be proud of, the fact that, you know, my son's heart is in somebody else, and you know that this person is alive because of that. Michelle is alive because someone, loved one, was so driven to help others that they signed that or agreed to organ donation to proceed at that time. So that's, you know, we need them here, and we will all go to dust afterwards.
Fantastic, thank you so much. So I've been your host, Dr. David Burton, from the Jamaica Diaspora UK Health and Wellbeing Arm. I'd like to encourage you to subscribe to and watch our webcast that we're having on a monthly basis. This is webcast 2 of X. We don't know how many we're going to have. We're going to keep on pushing the conversations, having these discussions. Our next webinar will be next month. Obviously, they're a monthly webcast. I'd encourage people to join the Jamaica Diaspora UK. It's a national organization that seeks to protect the interests of Jamaicans in the UK, but explore discussions outside of the UK as well. And I'd like to encourage you to all follow us on Facebook, Instagram, and Twitter. You're obviously already watching on Facebook or YouTube at this present moment in time. And I'd like to finally thank our guests, Michelle Hemmings.
Thank you.
Willis, Geraldine-Parker Smith, and finally, Dr. Velma Scantlebury, for joining us this evening. I really appreciate you all being here. Unfortunately, we can't do this in an open arena and hear claps of applause. So I'm going to clap you all. and thank you for coming.
Thank you.
And being part of this event. And I hope to touch base with you all again in the future. Michelle, I'm looking out for your next book, as well as Dr. Scantlebury's next book. Geraldine, you'll be across the ocean, sort of sorting out the Americas and so forth. Michael, we're looking forward to your projects as well. So please keep having those conversations, keep having the discussions, and keep bearing in mind in regards to organ transplantation and donation. And thank you and good evening.
Thank you.
Thank you.
Bye-bye.
Thank you.